your presentation would be marvelous, inshallah.
Inshallah.
Bismillah ta'ala. Okay, let all of you have arrived. 1, 2, 3, 4.5. Okay. First of all, let me take your attendance. Just download your attendance. Uh, who is Abdulaziz Ghazi? Raise your hand.
I'm Abdulaziz.
Yes. Okay. Hussam S Alqahtani.
Hussam.
Okay. Malek D.
Yes, sir. Here.
Okay. Omer Yusuf. Okay. Talal Hussain.
Yes, sir.
Okay. So I am going to download your attendance first. Okay, that's done. Alhamdulillah. Now, with the name of Allah Ta'ala, we are going to start our session. Inshallah Ta'ala, our session will be finished in 20 minutes. Okay. And inshallah, you are the first group. And just start. Who is going to start? Just decide by yourself and then begin. Bismillah.
Excuse me, sir. Just do you want us to show the poster here?
Better to show the poster.
Okay, let me upload this.
Yeah. Is it possible? Can I see your poster and your face also?
Yes,
sir.
Yes. Let's check here.
Excellent. Very nice.
Hussam, tell how to mute.
Very nice.
Can you see it now, sir?
Just a minute. MashaAllah, very nice.
Okay.
Just zoom
Our
in.
faces, can you see it?
Just please zoom in the part which is going to be presented. Like if you are going to present introduction, just make it prominent for me. Introduction.
Okay. So do we start now, sir?
Okay, go ahead.
Bismillah. In the name of Allah, the most gracious, the most merciful. Here we present the study that is titled Survival Outcomes of Patients with Primary Plasma Cell Leukemia Treated with Novel Agents. I am Abdulaziz Alotaibi and I will be presenting the introduction. To start with, primary plasma cell leukemia is an aggressive and rare form of multiple myeloma. It has two types: primary plasma cell leukemia, PPCL, and secondary plasma cell leukemia, which is SPCL. PPCL occurs de novo, which means it's the first occurrence of cancer or leukemia in the body. Primary plasma cell is common among young patients, and it exhibits a higher malignancy than multiple myeloma or secondary plasma cell leukemia. Also, primary plasma cell leukemia patients usually show high-risk features like renal failure and end-stage diseases. Secondary plasma cell leukemia, on the other hand, is an end-stage form of multiple myeloma that is resistant to treatment. Diagnosing primary plasma cell leukemia requires the presence of more than 2 × 10⁻³ micrograms of abnormal plasma cells in the blood. Before, patients received conventional chemotherapy had an overall survival of less than 12 months, which is a bad outcome. But with the involvement of novel agents, including proteasome inhibitors, PIs, and immunomodulators, IMIDs, some studies shown that patients had a slight improvement in progression-free survival and overall survival. Given the rarity of the disease, only 2 trials evaluated the role of novel agents in survival outcomes. First trial is GEMIMA trial, an Italian group. This trial was based on lenalidomide, an immunomodulator. It was used in induction and maintenance phases, and when it was applicable or when it was suitable, stem cell transplantation was received by patients. The second trial is the IFM trial. They used autologous stem cell transplantation, ASCT, and bortezomib in induction. They used also a combination of VRD in consolidation. VRD is a combination of bortezomib, lenalidomide, and dexamethasone. These are all novel agents. Also, lenalidomide was used in maintenance also. This was an overview about what to expect during the discussion of the study. Having talked about the introduction, we will move to the hypothesis with my friend Omer Alharbi.
So in your opinion, what is your opinion? Which leukemia is more lethal, primary or the secondary one?
Well, according to the study, primary plasma cell is the most malignant leukemia.
Okay. Now, who is the next speaker?
Me. My name is Omer Alharbi, and I will be talking about the hypothesis of this study. As what was known before, patients with PPCL were treated only with chemotherapy mainly, and if the patient was lucky, he will receive stem cell transplantation. From this issue in the treatment plans, stemmed the idea of using a novel agent in treatment plans. Also, previous studies about the use of novel agent were lacking some information. So the goal of this study to assess and observe the trends in the survival outcomes for patients treated with novel agents. Continuing on with the methods, and that's what my colleague Talal H will talk about.
Okay, your name is Hussam?
Omer Alharbi.
Omer. Okay, so what's your opinion about the hypothesis? This hypothesis is proved or not in this study?
Yes, I think it's proved, and you will see in the hypothesis and the methods and the results, the outcomes.
Okay, right. Who is the next one?
Talal H.
Yes, Talal, go ahead.
Yes, thank you, my friend Omer. This study was retrospective, also board approved. All the patients were registered in the Winship Cancer Institute database, which is in Emory University. The study included 38 individuals with primary plasma cell leukemia who were diagnosed between October 2005 and July 2016 and had undergone at least one PI, which is protein inhibitor, or IMID, which is immunomodulatory, and induction therapy. Patients were on average 58 years old when they were diagnosed, ranged between the age of 34 to 80 years old. At the time of the diagnosis, 58% of patients had bone diseases, 47% had hypercalcemia, which is a condition in which the calcium level in your blood is above normal, and 50% had blood creatinine level that is greater than 2 milligram per deciliter, whereas the average is supposed to be between 0.74 to 1.35 milligrams per deciliter. And overall, patients with PPCL were more likely than those with which is multiple myeloma, to have high-risk disease, and that makes it more aggressive. At the time of the diagnosis, baseline data were gathered, such as age, sex, isotype, quantity of monoclonal protein, which is an antibody found in unusually large amounts in blood or urine of people with multiple myeloma and other types of plasma cell tumors. Chemistry panels, which is a group of tests that are routinely ordered to determine a person's general health. Complete blood count, which is numbers of blood components, such as white blood cells, red blood cells, hemoglobin, etc. Bone marrow aspirate, which can show whether one bone marrow is healthy and making normal amounts of blood or not. Also, it's used to diagnose blood and marrow diseases. Conventional cytogenetics, which is the study of chromosomes by G-band, which is a technique used in cytogenetics to produce visible karyotype by staining condensed chromosomes. Conventional fluorescence in situ hybridization, known as FISH, which is a laboratory technique for detecting and locating a specific DNA sequence on a chromosomes. Radiological evaluation to establish the presence of bone disease, And finally, types of response to first and second line treatment, the dates of the first and the second relapse, the date of the last follow-up, and the survival status were all gathered in the steps. Moving to the results with my colleague Hussam S. Alqahtani.
Your name, good name?
Talal Binmushayt, sir.
Talal. Talal, do you have any idea about how the bone marrow aspiration is done? Which bone, from which bone the bone marrow aspirate is obtained?
I believe, I didn't look it up, I looked at it briefly, but I believe it's either the spine or the one and the thigh.
Usually from the spongy bone, especially, you are right, but to have an aspirate from the spine, it might be resulting in complications. Better to have aspirate from the iliac crest. Usually in the hematological practices, the hematologist, they use from iliac crest. So
can you say it again, sir?
This is the bone marrow aspirate. Bone marrow trephine and bone marrow aspirate. These are the two techniques which can be, the aspirate could be taken from iliac crest. The part of the hip bone, the broad fan-shaped part of the hip bone, the ilium. From the iliac crest, the aspirate is being taken in these patients. Excellent, very nice, mashallah.
Sir.
Next speaker.
Yes, this is me, Hussam, sir.
Yes, Hussam, go ahead.
Yeah, this is Hussam Alqahtani, and I'll speak about the results. First of all, to make it clear, the results was divided into 3 phases. The first phase was the first-line treatment, and then they had a maintenance treatment, and then the second-line treatment. The first-line treatment involved in giving novel agents, thalmoid and linomoid, and bortezomib, which involved in giving them in different cycles according to the patients. This first-line treatment was given to the whole sample size, which is 38 patients. After that, we come to the in the same first-line treatment, they added a autologous stem cell transplantation to increase the progression of the patients. Actually, patients had this transplantation. 10 of the patients didn't have it due to some factors. After that, we have the maintenance treatment, which involved in giving also novel agents. To make it clear, 45% of the patients from the first-line treatment achieved a very good response. And after that, the maintenance therapy was given to 23 patients. After the maintenance therapy, 87 patients was having a very good response, and at least they progressed in the disease itself. After that, we have the second-line treatment, which involved in adding also novel agents without the bortezomib that was given in the first-line treatment. They gave just the novel agents, which was the PI and the MID, which involved in increasing the patient. And overall, actually, 25 patients have died, and one of them have died in the first month due to early mortality rate of 3%. Moving to the first figure, as we see, part 1 in the figure, the upper one describes the progression free of the overall patients. As we see, it's decreasing. So patients wasn't progressing until some rate it had a maintenance, which never had a more progression. While in B, we have the overall survival in the study was also decreasing, unfortunately. Moving to the second diagram or second figure with my colleague Abdulaziz G.
So what's your opinion about the survival outcome in regarding the first line treatment and the second line treatment? How would you compare about the prognosis of the disease?
Actually, sir, the first line treatment was a good survival outcomes. We had a rate of 45% achieved a very good response, and it was this rate was so satisfying. Comparing to the second line treatment, it wasn't they didn't have a good progression comparing to the treatment. And I think I would give this a factor due to the malignant disease they have, which is a very hard to fight. And this was a result of 25 patients whom died after the second line treatment.
Okay, Hussam, thank you very much. Very nice. Who will be the next?
I will be presenting figure number 2.
I'm not.
Has 2 parts. The first part.
I'm unable to see the figure over here.
It's in the right upper part of the poster.
But I'm unable to see this. It is very faint, very faint. Yeah, right upper. Okay, go ahead.
So I think you can zoom in if you can.
Yeah.
Yes, figure number 2 describes the trends in the use of autologous stem cell transplantation.
Okay.
Part A describes the progression-free survival, and Part B describes the overall survival. The blue curve, as you can see, which is the upper curve, represents patients who received autologous stem cell transplantation. The red curve are patients who did not get stem cell transplantation. Progression-free survival was significantly longer in patients who received autologous stem cell transplantation in comparison with those who did not receive stem cell transplantation. The progression-free survival was 25 months in patients who received stem cells and 6 months in patients who did not receive. Moreover, a trend toward improved overall survival, although it was not statistically significant. It was observed among patients who underwent autologous stem cell transplantation compared with those who did not, resulting in a median of 36 months versus a 26-month median for patients who did not receive. That's figure number 2, and we'll move to figure number 3 with our friend Malek Alqahtani.
Mashallah, you people are very much confident, and I'm seeing your faces. I'm watching. You see very closely, and mashallah, you are very confident. What's your good name on my top right? Who is going to present?
Me, sir, the last figure.
Yes, what's your good name?
Malek Alqahtani.
Malek Alqahtani, you are the last one, okay?
Yes,
so, are you okay? Fine?
Yes, sir. Can I present?
Yes, of course. Go ahead.
Good afternoon. My name is Malek Alqahtani. As shown in figure 3, part A is progression-free survival, and part B is overall survival. The blue curve represents patients who receive maintenance treatment, and the red curve represents patients who didn't receive maintenance treatment. The receipt of maintenance therapy after ASCT significantly prolonged median PFS, 27 for those who received versus 11 months for those who didn't, with a trend toward a longer median OS, compared with no maintenance for the 38 who received versus the 22 who didn't receive. In summary, the study illustrates the result of the first cohort of PCL patients who had taken a new therapy plan, which included the use of PIs and IMiDs in the induction and maintenance stages of treatment. Moreover, ASCT was used as a consultative treatment that was aiming to achieve long-term remissions. Also, the maintenance was connected to better survival. However, the prognosis of PCL patients is not satisfying when compared to multiple myeloma patients' prognosis. Regardless of the bright discoveries, conductors of the study suggested the inclusion of second and third generation novel agents, monoclonal antibodies, and intensive therapy methods, which will aid in increasing PCL patients' longevity. That's all. Thank you.
That's it. Okay. So can you, Malik Dagash? Yes,
sir.
you are. Yeah, Malik. Can you sum up your all this? You see, you have presented this study in one or two sentences because you have given me the conclusion. Can you sum up your this study in one or two sentences?
Yes, sir. It sums up to 27 who received versus the 11 months who.
Say that by this study, the hypothesis is proved or a null hypothesis. So, Alhamdulillah, all of you, Hussam, Talal, Abdulaziz, Omer, and Malik, all you have performed very well, mashallah, and expect good scores, inshallah. Wish you all the best. You have finished in time. This is 2:20, and now this is the time for the next group to come in. May Allah bless you all. Ma'as-salam.
Thank you,
very
sir.
much.
Thank you, Dr. Saeed.
Thank you,
We
sir.
appreciate
Thanks, sir.
it.
Have a nice
It was,
Same to you, brother.
it was a great honor to be supervised by you, sir. Thank you.
Agree.
Jazakallah khair. Hayakumullah.
Have a great day, sir.
Soon.